Again, and welcome to the inaugural International Clinical Analytics Summit. My name is Beth Hawley. I'm a principal advisor at MITRE, and I've had the pleasure of working with our MITRE and UVA teams and the speakers in planning today's summit. Before we begin, I'd like to take a minute and just talk about a few housekeeping items. The restrooms are located just behind the security desk. The women and the men's are on either side of the MITRE dining area. Today's session is being recorded. We ask that no additional video or audio be taken of the sessions. The product of today, all of the video, will be available to you and to any of the stakeholders that are interested. So thank you again for following that policy. If you're interested in accessing the internet, the passwords are located along the walls here. And if you have any trouble with that, I would like just the MITRE team to raise their hands. If you have any questions, these folks can certainly help you along. There are several meeting rooms along the hall behind me that have been reserved for today and for all of your use. So if you have small meetings, need to make a phone call, anything, please feel free to use those rooms. The one room, though, room 205, which is directly in the middle of the hallway, is being used for a technology demonstration from the University of Virginia, which will be up and running all through lunch. So we hope that you'll take the opportunity and stop in and see that. Lunch will be served in the foyer, just where the breakfast networking area was. We are planning lunch, hopefully, if we stay on schedule, from about 12:15 to 1:15. There'll be two breaks today, one in the middle of the morning sessions and one in the middle of the afternoon session. And again, if you need anything from our team, please feel free to reach out. And at this time, I'd like to introduce Rob Jensen, who's the MITRE Vice President and Director of the CMS Alliance to Modernize Healthcare, and Dr. Randall Moorman, who's a Professor of Medicine, Physiology, and Biomedical Engineering at the University of Virginia. So without further ado, Rob?
Thank you, Beth. I appreciate the introduction, and it's really a great pleasure to be here with you at this first International Clinical Analytics Summit. I'd like to call it the first annual Clinical Analytics Summit in the hopes that this will continue, and we'll have to open the doors in the back to make room for the new folks that want to attend. One of the reasons that I'm here, and I trust many of you here too, is that we're invested in the potential of healthcare transformation and the specific opportunities around strengthening our system to improve not just the care, but to make patients safer and ultimately improve health outcomes along the way. MITRE operates the CMS Alliance to Modernize Healthcare, and we work across government, primarily the federal government, on a range of business policy, technology, and operational challenges. One of the most important purposes is accelerating the pace of translating innovation and discovery into practice. When I first saw the awe-inspiring work at UVA, I wondered how we could begin the integration of their work with others, and how, if we were really visionary, we could leverage it to a much larger scale. This summit is what we hope will be the first step in that larger journey. As much of an effort as we are putting into it individually, ultimately, it is about how we come together to solve this problem that will make us successful. Our common objective connects us, and to reach our goals will require working together, integrating and scaling successes each of us have beyond our own organizations. We share with you a hopeful vision of a smarter healthcare system on a national scale. Before I hand over the mic to our partner, the University of Virginia, I want to thank you for being here, for your tireless motivation, continued commitment, creativity, and focus on our changing and challenging part of this world. I will leave you with a thought paraphrased from the writer Frederick Buechner. Your vocation is the place where your deep gladness and the world's deep hunger meet. Thank you for answering your individual calling and making this journey together a possibility. Dr. Moorman?
I was taking care of inpatients on the cardiology service last week, and at 7 o'clock Sunday morning, the house staff team and I stood at the bedside of one of our patients, a retired 84-year-old internist. We showed him his chest x-ray on a handheld display, and we talked about how we could replace his diseased aortic valve without open heart surgery. And at the end of that conversation, he and I marveled for a moment at how far medicine had come. Now, in arranging this summit today, and in my work with MITRE, I've met people who are deeply expert in big data and information management. And together we have marveled on more than one occasion and for more than one moment how medicine has not come very far at all. So here we are on the one hand taking better and better care of our patients, and on the other hand, in some ways, still in the Stone Age. So this is what we're here to talk about today, how HHS and the federal government can help doctors, nurses, and industry help ourselves catch up. You'll hear today from people that I consider to be pioneers in the field, each with heroic tales of using large-scale information to take care of not just their patients, but everybody's patients. We are all experienced clinicians. Some of us have very busy practices indeed. We've all seized help from our colleagues wherever we could, and despite a commonality of purpose, we found little in the way of commonality of materials and methods. I ask you to listen to all of these stories, to hear about this progress and to feel this promise, but to hear about the problems as well and to help us to act, to move forward. The question is not whether or not big data can be used to improve the care of individual patients. We know the answer, it's yes. And the question is not when that ought to take place. We know that answer as well, and the answer is now. What the question is how the government can use its awesome capabilities to help us make this transition into the information age smoothly and rapidly. People are still getting sick out there, and we are still trying to take care of them. We can do better with the data that we have if we're smart and organized about how to do it. Let's figure out a way to work together to make that happen. Thank you.